this video, I want to talk about the gentle sleep training technique, the chair method, what it is, who it's suited for, and how to implement it successfully so that you can teach your baby or toddler to sleep independently. Hi guys, welcome back to my channel. I'm Rena, a paediatric sleep consultant and a mum. Having been through my fair share of sleep challenges with my 6-year-old when she was a baby, I can relate to so many of you watching this video and wanting to improve on your little one's sleep. So let's get right to it. The chair method is a really gentle sleep training technique where you would phase out your presence gradually until your little one can fall asleep on their own. In this method, you're essentially putting your little one into their cot or their bed and then sitting on a chair or cushion and offering physical or verbal reassurance to support your little one to sleep, but in their sleep space. And then you gradually move further and further away every few days from their bedside until they can fall asleep independently. The chair method is suitable for little ones aged 6 months and over, and actually can work really well for toddlers and young children too. It's ideal for little ones who are anxious or experiencing separation anxiety, as the approach allows you to be present whilst they fall asleep initially, gradually reducing your presence over time. Now, the beauty of this approach is that it can be individualized and carried out at a pace that suits your child's temperament and your parenting style too. I would say that the chair method might not be effective for children who may get distracted or distressed whilst trying to settle to sleep in your presence. Now, the advantage of the sleep training method is that it can involve less crying than other methods such as cry it out or the time checks approach. However, because it's a gradual approach, it may take more time to see results, usually 2 to 4 weeks on average. So if you feel like the chair method aligns with your parenting style and your little one's personality, let me now talk you through exactly how to put it into practice step by step. So first start with the 4 B's. So you've got bath time, bottle or breast if that applies to your little one, book, and then you move on to bed. Now place a chair or a cushion right by your little one's cot or bed, and then you're ready to begin. So after you've read that book to your child, you can give them a lovely bedtime cuddle, wish them good night, and place them in their sleep space awake. Then I would suggest you sit on that chair that you've placed next to them and observe your child for a few moments when they lay in their cot. If they seem calm and playful, just turn away or maybe even close your eyes. If they seem upset, you could lay your hand on the mattress, or you could offer some gentle shushes to calm them down, maybe even pat them or hold their hands in those early stages to offer the additional support. Some little ones will be calmed by your physical and verbal support. Others could find it unsettling, so just follow their cues on this one. Try and look away or even close your eyes where possible if your little one is calm, and let them have the opportunity to settle to sleep independently. Now, I want you to really try and keep that environment calm, quiet, and as boring as possible. If your little one is upset, try and reassure them with the shushing and the physical support, but try to support them whilst they remain in their cot. Picking them up can actually be quite confusing for your little one because they may think they're then coming out of the cot, or in fact, if they're exhausted enough, they may fall asleep in your arms. Eventually, you will find that your little one will settle to sleep in their sleep space. I suggest you just sit there on your chair for another 10 minutes once they fall asleep before you leave the room. And then you want to repeat the process for a few nights until your child gets used to falling asleep with you sat next to them. Try and minimize the physical support during this time and offer those verbal reassurances such as shushing and even saying something like, "Shh, sleepy time, mummy is right next to you," could be a good option. After a couple of days, you can move your chair a little bit further away from the cot and then repeat the process, offering those verbal reassurances if your little one gets upset. But if they're calm, you can just leave them to it. Every few days, I would suggest moving that chair further and then further away, closer towards the bedroom door, and eventually you'll find yourself outside of your little one's bedroom. Just remember that even when you reach this point, if your little one is upset, you can offer those verbal reassurances from outside of the door to support them. Now, with these steps, you will get to a point where you can do your bedtime routine, wish your little one good night, tuck them into their sleep space, and then leave the room and allow them to settle to sleep on their own. Of course, as I mentioned earlier, you can absolutely go at your little one's pace, taking things slower if necessary, or if they're adjusting well, you can speed the process up. I would suggest repeating this method for every single night wakings that can occur. And after 3 days of implementing this method at night, you can now then start to use this approach for your little one's nap times too. So now you know exactly how this chair method works. I want to share with you my top tips for success. Always set up that chair or cushion beforehand so you're ready to get started as soon as you've tucked your little one into bed. Do remember that in those early stages, it can sometimes take a little bit longer for your little one to settle to sleep with the new method. So do all the things you need to do to prepare yourself too. Maybe have a bite to eat, get changed into your pajamas, and just be comfortable in case you're sat on that chair for a really long time initially. Also, whilst you are sat on that chair, I would suggest not looking at your phone or reading anything. We really want to keep that environment calm, quiet, and as boring as possible so you're not stimulating your little one whilst they're trying to settle to sleep. I would suggest just keeping your eyes closed or looking away. Now, this technique is really effective at getting your little one to fall asleep independently, but what I would say is that you really need to stay committed and consistent with the process to see really good results. I would also say that in order to see success with this method or sleep in general, it's really important to establish a consistent bedtime, nap time, sleep time, wake up time, and general sleep schedule. This can actually improve your little one's sleep as it regulates their internal body clock by sending signals to the mind and the body that it's time to wind down and prepare for sleep. So there you have it, my step-by-step guide to the chair method, which can have your little one falling asleep independently in their sleep space. Whether you're wanting to move away from co-sleeping, or you're wanting your little one to settle to sleep independently, or you're finding that there are multiple night wakes and it's not sustainable any longer for you to continue supporting them to sleep during the night, this might be a good option for you. If you want these steps broken down and customized based on your individual needs and your little one's needs, then I would suggest reaching out to me via the description box below, and I can support you every step of the way. I really hope you found this video helpful. Thank you so much for watching. Have a fab day, and I'll see you in the next video.